Today, we're talking with 3 government leaders who are finalists for a Service to America Medal. They're being recognized for their outstanding contributions to their fields. First is Dr. Diana Bianchi, the director of the Eunice Shriver National Institute of Child Health and Human Development. Dr. Bianchi, welcome to the program.
Thank you.
You helped launch a lot of large-scale studies that at the start of the COVID-19 pandemic. But I want to start with the effect of the COVID vaccine on pregnant women. What did the research find about that?
Well, bottom line is the research has shown that there are no adverse effects to pregnant women if they get vaccinated. Actually, unvaccinated women are at high risk, if they're pregnant, at high risk compared to women of the same age of going on a ventilator, having severe pregnancy complications like hemorrhage, preterm birth, and stillbirth. So our funded research has shown that getting vaccinated does help avoid these complications.
But how do you do safe research on pregnant women without putting them at risk, them and their fetuses?
That is an extremely important question. And in general, pregnant women are often considered last because formerly they were considered to be a vulnerable population. They are no longer considered to be vulnerable, and our institute has been very strong in terms of advocating for including pregnant people safely in research protocols. So one of the difficulties with COVID was everything happened so fast. The vaccine was given first to older adults, and our concern was there was no initial plan for pregnant women. So we had to rely on information collected by other agencies, but we also later on did studies to show that the vaccine was safe.
You know, you've said this, quote, pregnant people need to be protected by research, not from research.
Exactly.
Explain that.
There has been, in general, a very protective attitude towards pregnant people. Pregnant people are adults. They're capable of making their own decisions. And if explained properly, in this case, a lot of healthcare workers, for example, if they were pregnant, took the vaccine early, knowing that their risk of acquiring COVID was higher than the risk of the vaccine. We've argued that pregnant women need to be considered in all studies. There needs to be a plan. You need to do studies on pregnant models, such as animals, to see if there's any evidence of birth defects as a result of the vaccine.
You also funded research on the effects of COVID on children. What did you find?
Well, COVID initially was not thought to be a problem for children. Back in the beginning of the pandemic, it was thought that children were healthy, they would recover, and it really wasn't until May of 2020 with the first reports of the multi-system inflammatory syndrome in children, or MIS-C, that we realized it could be very serious, requiring ICU admission and possibly death in children. So that really ramped up our efforts to be able to do studies to test medications that were being used in adults, such as remdesivir, on children to see if they could be treated safely. And then we funded studies to predict actually who would be at risk for developing this serious consequence called MIS-C. And we've made enormous progress, and we'll have point-of-care tests coming out in the near future to test which children are at risk for developing this complication.
But right now, kids are back in school. Mostly, they're not masked. How do you feel about that?
Well, our studies have shown that masks are effective. The children who need to look at lips, for example, for lip reading can still learn with masks on. Children have learned to interpret facial expressions from above the mask. Our studies have shown conclusively that masks do work. However, we recognize that in some communities that is not the choice. But our research was aimed at getting children back to school as soon as possible, because children have suffered by not being in school. And whether it's not receiving services that they might need, or lunches or breakfasts or exercise or psychological services, the children are so much a part of the puzzle of America. And they need to be in school so that the parents can go back to work as well. So we initially focus on getting children back to school safely, looking at different mitigation strategies, masking, hand washing, social distancing, et cetera, and now keeping them in school safely, because we know that children need to be in school and they want to be in school.
You know, in general, when it comes to federally funded medical research, how do we ensure that pregnant women, children, those living with disabilities aren't excluded from the beginning of that research?
We need to speak up, and this is what all of the staff members in our institute do every day. We advocate for these specific populations so that they are not forgotten. They are very, very important for the future of America.
All right. Well, Dr. Bianchi, appreciate all your efforts, and thank you so much for being on the program.
Thank you so much for having me.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.